Oh, you sweet summer children. Hi. Really, thank you. Thank you so much for all of your concern and for all of the messages and the comments on my last video last week. Here I am again, and I've chosen a better camera angle this time. I looked pretty bad, didn't I, last time? Sorry about that. It's been a while since I've been here, so I wasn't really aware of what I needed to do or not do to make a successful video. I believe my neighbor has left. So maybe the sound effects won't be as terrible. So when I posted that video last week, most of my friends in the United States were the ones who were showing the real concern. And I realized that this reality of mine, my norms as a person with a chronic disease, but also as a person living overseas, they're not so easily understood or even known by people living in different regions or having their own health conditions. So I'm making this video specifically to lay out and explain it all for you and hopefully lower whatever worries you might have. Now, I've been living outside of the United States since 2009, and I forget these things sometimes, so please forgive me about that. You've been living in the USA for most of your lives, and you're probably reasonably healthy, so you might not know that a lot of these things about medical care are different for people with these types of illnesses or for all of us out here living in the outer world where national health care is kind of a thing. So first things first, okay? In the United States, time out. I'm sucking on Werther's Originals because I'm old, but also because Solumedrol gives a kind of coppery mouth taste. It's pretty gross. So in the United States, when you hear that someone's in the hospital, it's often bad or scary, or there's been some kind of emergency, and that's understandable, given the way we utilize or don't have access to healthcare in the United States. I completely understand your concerns. When I lived in Germany, I saw my doctor at a clinic near my office. He was great, and I never required any special treatment for my MS out there. The best thing he did for me, aside from, keep me at baseline, which was necessary, he did help me convince a hospital to time my remaining tube so I could never have children. And that was so useful. I am forever grateful, and I appreciated actually being heard by a doctor. All of my gynecologists in the United States repeatedly refused me this procedure. I had to go out of the country to get it done. But here in Japan, obviously, I'm doing different stuff. So here in Japan, especially in Tokyo, most of the doctors are in hospitals, and the healthcare system doesn't really require referrals. I can see whoever I want most of the time. That said, private practice and small clinics are not for neurology, okay? GPs, pediatricians, maybe, but neurology, not so much. My neurologist is my primary doctor, basically. So I visit him and thus the hospital he works at every few months. That's totally normal. However, I do get a normal health check at a clinic near my home once a year, which is free, courtesy of the national healthcare system. Otherwise, I don't get sick very often. Don't you worry about those background noises, okay? It's all good. However, I am forever at the hospital, just to see the neurologist, just to check in and say hi. The reason I'm there all the time, here, literally here right now, is because I just can't get a prescription for MS drugs and roll out and never be seen again. It doesn't work that way. MS requires constant monitoring for lymphocyte counts and a host of other levels that need checking. Please trust, though, when I say that I'm fine. I'm so good, I promise. I'm good. I'm the healthiest I've ever been. I require these check-ins. That's standard practice for multiple sclerosis. In Japan, Prescriptions are usually maxed about 3 months if you're lucky, and that's if you're kind of doing well. Even for daily medication, you have to come in and get checked to make sure you're doing well on the drug and not having any adverse side effects. And when I changed my drug the first time here 9.5 years ago, I came in without any drugs and I had to go on to the new pill, Gilenya. At that time, I had to be admitted for 3 nights for monitoring. Japan doesn't really fuck around when it comes to side effects. I'll explain why later. And that's why I had to be in. This time, as I'm changing my drugs again, I'm leaving Gilenya, going to Kesimta. I have to come to the hospital once a week for a Solumedrol steroid infusion, then the actual drug injection, and then 1 hour of immediate observation. And I'll do that for 2 more weeks after this. And again, this is just to monitor for immediate side effects. It's not because anything's actually wrong with me, okay? Good. Now, if you're wondering why Japan is concerned about side effects, that's because as early as the 1970s, I'm reading now, as early as the 1970s, there were class action lawsuits filed against the Japanese government over side effects that were related to smallpox and other vaccines. There were 2 deaths that followed vaccination for the diphtheria, whooping cough, and tetanus shot, and that made the government actually stop giving those injections for a while. And even after they were reintroduced, public confidence never really recovered. And then the big thing that happened was that the late 80s and early 90s, when we were all getting our injections over in the USA, there were cases of aseptic meningitis among children who received locally produced MMR vaccines, and that caused a new outcry, and now that injection has also been withdrawn. So there's a bunch of childhood vaccines here that they don't do, that in the States are still mandatory. So public confidence never really recovered after all of these things, understandably so. The country is about 30% pro-vaccine, which is really scary and shocking, of course. Moving forward, I do hope that they will be able to renew their feelings about vaccines as medicine improves over time. But that being said, Japan is a country that is very concerned about any side effects, and so the possible side effects for switching to Kesimpta aren't actually all that bad, but I do need to be monitored because that's the standard practice here. So again, thank you very much for your concerns. Thank you very much for reaching out and asking if I'm okay. I'm okay. I'm fine. My arm's a little cold right now because steroids are cold going in. It's really weird. My mouth tastes like metal, so I'm eating hard candies all for the next 3 hours probably. But we're good. We're good, okay? I'm good. It's good. It's all good. I've got exciting news coming up later. Thank you. Thanks for your concern. Stay safe, stay healthy, and always prioritize your health. Everybody thinks they don't need to see a doctor. They don't need good health care until they do. So, prevention is best, okay? Do what you can. Love you. Bye.